Well, greetings again. This is Dr. Bill Wyatt with the American Orthodontic Society. And I think there's one thing that a lot of the people are not quite aware of is we can expand anybody's arch. In other words, you could take the upper out or the lower out, either way you want to, bringing it out. Now the large arch wire that we build and put it in, I'm going to show you how to make it first, and you make it fit the arch, and now you bend it out like this, and you tie one side down, and now you can measure how much weight it takes to push this big wire back down and tie it on the other side. And then you divide that by 2, like if it takes 20 ounces to force to push it down here, then you'll have 10 ounces on each side, or you can have 6 ounces or whatever you want to do it. But you can expand anybody's arch. I don't care how old they are or what nationality or whatever it is. You can expand their arches as long as people live. So I want to get that across to people, but you do not do it with just the one large arch wire. Now the big arch wire will expand and gives a positive torque in the teeth. And I'm going to draw some of this out and show it to you later. Maybe just to start off with, it might be good to draw this wire and show it to you. And whatever, I'm going to go here, like if we, all right, here is making the large arch wire. In other words, we use an 040 wire or an 036 round wire, or some people are kind of chicken on that. They may want to use an 030 arch wire, but I like to use either 036 or an 040, depending on how much force you want to bring in, bringing these teeth out like this over here. Now you make your wax pattern, and these are the cusp, here's the brackets. You can see them lined up and rolling around like that. Now we're going to build this wire to fit first, and then you expand this. It goes like that, you take it out, and we're going to bend it out where it's coming like more like this. Now you can tie one side down, and now you push the other one in with a Orthodontics gauge, which is a way of measuring the force on that. And we've shown you a Orthodontics gauge. It's just like a fish scale. It measures pushing or pulling. It'll tell you how many ounces you got on there. And so let's go in and look at making this Big Daddy wire first, and then I'm going to show you, you have to put a rectangular wire underneath it to do the buccal root torque. So here we bend the wire, we make it, take it and bend it to fit. Now we expand it out so much on each side like this. And you can measure, if you pull this side up down here, and this one will be out here, and you can measure how much force it takes to push that up to the teeth. And that's how much it's going to be pushing. And you tie both sides in, it's going to have force bringing these out like this. And there'll be more force back here. It takes these molars out further than it does the bicuspids. And we have to bend a small rectangular wire that fits in here to get the buccal root torque. Now the big arch wire, if you just put it on here and do anything else with it, it'll move the teeth in this direction. Now that puts a positive torque it tilts the case tooth like this. But then we need to bring the roots out as we pull it back in. And that's where people find it difficult to do or don't remember how to get there. And that's what I wanted to teach you this morning, is how to properly use this large arch wire to expand anybody's teeth you want. Okay, now this is just the big wire we've got in there, but we have a small wire inside here, and this is the one that you have to, the small wire is the one that you got to put this progressive torque. It's more, you bend it up here, and I'll show you that at the end. But we're going to put this large arch wire in. You can tell how much force you got. Now it'll tilt the teeth, but it doesn't like, it just brings the crowns out like this. And I want something to bring the roots and the crown out at the same time to restore the airway. Let me go through this. So this is an 036 or 040 wire. We make it like that, and then we expand it. And now I come in, say, oh, the bottom arch, you put a little loop in this wire, and you mash it down, and you tie it between the first molar and the second molar right here. And this wire needs to be stiff enough in here to carry both teeth out, and it'll move them out like that. Now you take that, that's blowing it up, you bend this wire and make it like that, then you put your wire up here and down here, and you mash it, and this will come together down here to this part. Now this wire will fit underneath here as we go. So this is where the lower one fits like this, and the upper one slides in a tube right here that you have on the upper 6-year molar. And then you have to bring a wire across like this to carry the second molar out with it as you go. Now there it is, hooked up on both sides. Now here we worked up and put a round wire in here, but you got to get in a rectangular wire if you do any torquing much at all, because you want to, now this would be the crown right here, and if you put that in, it does like that. Well, the crown rotates, and so the roots would go in, and so you're trying to build the airway back in most of these adult cases, and so you want to bring the roots and the crowns out at the same time. Now this is making the large arch wire, but then we got to make a rectangular wire to put underneath here and get it engaged in that area. So there we have the arch wire. Now you can do it. There's other ways of, this is a kind of a super wire, which I just say, forget about doing it. You can expand this without making this wire here. Like if you want to expand these, you just bring the regular wire out like that, and you tie these teeth to it. So just forget about this part right there. And we expand that to bring the lower teeth out, but you know that's so complicated, I don't want you to even worry about it. So we start off, put the center of this wire, and it'll come on out past it like that. And so it bends, it takes the arch and does this to it. It doesn't do much, but as you expand the sides of an arch, it'll come in from the anterior part and go back. So some people, we want to bring their teeth in a little in the front part of the mouth. We just put the big daddy wire on it, and it'll go out like that. And as this goes out, it comes in on the front part of the mouth. Now I'm going to run through that. Now here we've tied that in. Now I'm going to show you how to prepare this rectangular wire for the inside. Now this is the 04 wire. It's expanded out like that, and then we push it back in and tie it. You make it fit first, and then you bend it out, and now you tie one side, then you push the other side in, and it'll be the same force on either side of the mouth. But if you're going to do any expansion very much, you've got to put a rectangular wire in here. So here we go with it's got the round wire in there yet. All right, here's the way we make the Big Daddy wire, just to run it over a turret like that, or you can run one over just something about the size of a broom handle, something like that. And if you're going to do that side part, we would do that. But I'm going to tell you, just forget about this right here and do the expansion otherwise. That gets too complicated. And you can do the same thing now up above, where we're opening the upper arch, and we deal in a tube here. You have to carry the second molar out, so you run a little arch over here, and it'll bring that out too at the same time. Now, if you're going to really torque it out, you're going to have to put a bracket back here and have that wire bringing the root out. Now, here is the way we put this torque in a regular rectangular wire. Now, when we talk about that, we use a rectangular wire, and we use 018 slot, so it's 018 on this dimension, and it's 025 down here on this dimension, coming out here. Now, you reach right behind the cuspid tooth. The cuspid tooth would be in here, and right behind there you grab it with a pair of pliers, and you go out here and bend the end of the wire up like that. And now we're going to twist this plier over here and hold that like that. And we're going to do that for an upper or lower arch. Now, let me go and draw some teeth off here for you a minute. You're going to twist that and put about 90 degrees of torque in it. And you bend it. You bend this from here to here, and the wire looks something like it's coming out of the back, coming out of the cuspid right over here. You don't put this in the torque in the cuspid. You bend it, and at the end it looks like that. Or if you're looking, let me get over here, and I'm going to draw a set of teeth over here and show you the okay. Now, a lot of people who are tongue thrusters and things like that, and they grow up with that, and the upper arch will not develop out properly. They're going to swallow them properly. And so there's a lot of these arches need to be widened out, and you need to, and the large wire will carry the tail out this way, but if you just put it on, the roots go in this, like this, and so you lose airway doing that. So we've got to put what we call buccal root torque in the teeth. Now I'm going to kind of draw the teeth on here and show you how we do this. Now this, a lot of times people will start out, now these teeth will have roots, something like that, you know. Now if you just put a large wire out here and go in and you bring it in on each side and it's pulling out, it puts positive torque. It'll bring the crown out in this direction, but the tooth will rotate somewhere like that. So the roots go here and the crown goes out there. But this is not what we want. We want the roots and everything to go out the same way. Now sometimes this will not develop properly, and on the bottom arch, maybe the bottom arch is fitting in like this. And it should be more or less this way. You want the upper molar to fit over the lower molar, and the lower molar fits in here. And that has the cheek out here, keeps you from chewing your cheeks. And so we're going to try to expand these teeth up here. So let me show you what we do. If you kind of look at this bracket slot, it goes out like that, and the wire normally would be straight in here. So we come back behind the cuspid, and we want to put something that's going to make this tooth move in that direction. In other words, we'll want these roots to push out in this direction. So you got to take this wire and bend it down like that. In other words, you come up and it will go down this way. Now when you flex this wire, put it in the slot like that, it's going to tend to make the tooth go here. Now if you don't have this large wire to support it, the torque will overpower. The crown is in the air, the roots of the tooth are in the bone. And so instead of these teeth going out in this direction, if you just put this rectangular wire on there, the crown will go in this other direction. Now that gets people confused on it. So you put like the slots here, and you want to make this tooth move in that direction. In other words, so you put this torque and you have the wire going down, you bend it 90 degrees here. And so you take the wire, make it bend in the end, and then you bend that wire to where it's to stay at 90, or you can put maybe 120 degrees in there. And so you got this twisted way down here. You come up and then this is twisted down. Now we bring it up and put it in there. The wire wants to do that. It has more force in the molar area than it does in the bicuspid area. So the rectangular wire is putting buccal root torque going in this direction, and you don't let it push the crown in. You pull this large wire here in and tie it to these teeth, and it's going to bring the crown out, and then your rectangular wire brings the roots out at the same time. So this is the way we can hook that up and put it on anybody's arch, and it'll expand both sides. Now, both sides would move out. Now, if you just want to push one side out like this, say you want this side to go out, and you don't want this side to go out, then you push this in, but you're going to have to take as we expand this, we put a rubber band from here, hook it up like that, and you come over here, and you got to say this tooth is the one that really needs to be expanded like that, and we want it to go out. So you put a rubber band, hook it on the buccal side of the lower, and go to the lingual side of the upper, on the side you want to go out. And then this over here is pushing. So this Big Daddy is trying to go with both sides out, but you put the rubber band, and this now makes the movement over in this side of the mouth. Now it'll move this a little bit, but it'll move this. In other words, we take 3/4 like this and this and this to bring this out. And that'll expand the upper arch on both sides. Well, this would bring it on one side only, and if you want both sides to go out, then you don't have to put the rubber band. You just expand both of them out. So this is hard for somebody to understand. And so I hope that'll get the point across. Because this is what we really need to know. Now I'm going to erase that, and we'll go back over here. Now we put this progressive torque in the rectangular, and that's going to make the tooth go here. We won't let the crown go in, but it'll hold it out with a Big Daddy wire on the side out here, and that causes, it puts all this force now on the upper roots, and they go out with the crown. And so we can expand somebody just straight out in that direction. Now this is hard for people to understand, but you're going to take this rectangular wire, hold one end, and then we're going to bend the other end down. We'll go like that. And you twist it up, put it in here, and that wire's doing that. If you don't tie it out with a Big Daddy, the crown will move in. And you tie it like that, and then it'll put force for the roots to go out while the Big Daddy's going out on the crown. It's carrying the roots out too. And that's hard for people to get down in their head. So I hope it'll show you how to do that. And that's the way we do it. You catch it there, and then you're going to bend that until this end is going down over here. In other words, the wire then will go and make this kind of a bend, and then you turn this up, hook it up in there, and it's going to carry the root out as you carry the crown, and don't let the crown go in. The large wire will force it out in that direction. And that's the end. If you can decipher what I said there, that is the way we actually do root torque. In other words, if you just expand with a Big Daddy, the tooth goes this way, and you don't want it that way. You want to go out like this. And this is your airway up here, up above. And as you carry that out, that increases the airway and restores it. So somebody that grew up and let their arch wire develop the wrong way. So thank you for watching, and I'll sign up, and I hope that's something you will understand. Thank you very much now, and I'll close out.